Lovely. So I think we are now recording our Council of Governors meeting, and therefore we are live. So welcome everybody, and delighted to welcome you to our first formal Governor meeting of 2025. So really pleased to see everybody. Some of us had the opportunity to have an informal workshop prior to today's formal council, where we've talked about our mental health and learning disability and autism collaborative, which was really lovely. So thank you to colleagues who joined the earlier session, which will be available for distribution. We have recorded it. In terms of our formal meeting today, which obviously is observed, can be observed by members of the public, and will be available for viewing later as well. As I said, this is our first meeting of 2025, so I need to note some apologies. So we note apologies from Sheila Begley, Mike Bouden, Simon Davey, and Adam Webb. So those are people we've received formal apologies from. And we are delighted to welcome Duncan Orr. He's the new audit chair for NHFT, and a huge thanks to governors who were involved in supporting the recruitment process for non-executive directors, through which Duncan has joined the team of non-executive directors. And I also note apologies from Dave Mayer, who isn't able to be with us today, but obviously he and Angela do occasionally alternate, and we are delighted that Angela's with us as our CEO today. So that's the formal introductions. As I said, the meeting is being recorded. Declarations of interest, just a reminder, we do have a declarations log that's available, paper A, and just a reminder to governors to make sure that people keep that up to date, as that is a public document. The minutes of the previous meeting, which was held on the 12th of December, is there for approval. Can I just check with colleagues if everyone is content that the minutes represent an accurate view of the meeting we held in December? If that's the case, we can approve that. So that's great. Thank you very much. We move on then to the action log. Now, there was an action open, which was an update. Well, it was a question that was originally raised by John. And we did, I think, have a conversation about an update at the last meeting, and it relates to our crisis cafe opening times. So just to say that we sent a response to John so that he had that response in between meetings, but I thought it might be helpful to put in the public domain the response to the question. And so broadly, it's about really clearly we recognise that easy access to crisis mental health support is a really important part of the sort of service that's offered to people of Northamptonshire. And the option of increasing the opening hours was considered. As colleagues heard in the earlier session, this is very much done in conjunction with Mind, who is one of our voluntary sector partners. But since many people currently have to travel to access a crisis cafe, we believe we would deliver a greater overall improvement in access to crisis mental health support by introducing new local hubs to operate alongside our current crisis cafe offer. And that's a sort of development that's in train at the moment, and the plan will be to update you a little bit further along the line when some of this the new locality hubs are in train. So at the moment, it's not seen as something we can do and can accommodate, but mindful of the importance of this. there are plans to develop new locality hubs. So it's work in progress and not something that I think the organisation felt it could sort of respond to immediately. So hopefully that's a suitable update. As I say, it has been shared with John, so as part of the question and answer process that we operate called a QI log. So it was sent to John. So that's the only action point outstanding from a previous meeting. So I'm really happy now to move on to our session one, which is a sort of opportunity really to hear from a governor, but also to receive our councillor governor's report from Richard Smith. But I'm really pleased that for the first time we've asked one of our public governors to give a bit of a sense of his role and his background and what he's involved in. It's not something we've done before, but we thought, well, why not? We've done partner governors before, we've done staff governors. So we tapped Pete up, I think, and Pete is lined up to present this item. So delighted to hand over to you, Pete, and I'm sure you'll happily take some questions at the appropriate point. So over to you.
Yeah, no, thank you. And I was going to say Happy New Year. It's not still too late to say that, is it? I suppose, as we just got into February. I was asked to do this lastminute.com. So I'll put some things together, and Joe's going to be my right-hand support here and click as and when I smile. But if you'd like to go on to the first slide, Joe, for me, please. I spent my younger years on a farm as a young man, being brought up by my grandparents. I come from an adopted background, so I knew who my mother was, but I didn't know who my father was. Being brought up on the farm gave me a great connection to the outdoors, which, as I said down in my narrative there, that led me then at 17 to join the RAF, and I spent a long time, 23 years in total, traveling around the world, and it was a real good foundation for me, and I am where I am today because of the foundation that was done earlier on in my life. And I'm really grateful for my grandparents, who are no longer with us, but they made such a big influence on my career and where I went. I joined the Air Force as a young 17-year-old, and by the time I was 19, I was on frontline jets out in Germany, part of the Cold War, working with the Jaguar force that was just coming in, replacing the Phantoms, and then was replaced later with the GR3s and the Tornadoes, as we know. And part of that training took me away on adventure training. So again, I then found myself at 23 years of age out in Central America running a diving centre, which for me, 5 years earlier, I was working in a warehouse in Worcestershire, and 5 years later, I'm living the life in the Caribbean, given the rank of sergeant by the Army, even though I was in the Royal Air Force, and running a diving centre, taking people diving. And that was really my first connection with wellness and well-being. And part of the military's support, really, back in the day, was to we couldn't turn around and say, oh, would you like to come for a walk, or would you like to come and do this and come and do that? Because servicemen back then were very much, we were very top heavy with men in the armed forces. So we had to find a way of trying to get their mental health into a level where they could be able to balance. So we used adventure training as a core support mechanism. Hence the reason why I was out in Central America, and I was taking all sorts of different cases that were coming over to St George's Quay. We were taking them out diving, sailing, and doing whatever, and giving them that, allowing them that chance to talk. And that's where really my footsteps started on this journey in psychology. That I've ended up being a social psychologist now, and that's back then. I didn't realise that was my foundation. And can you go on to the next one for me, please? So. Yeah, I've had a varied career. Here's a young picture of me as a young man. I just thought I'd throw that in there so people, realise I did have quite a young look about me. And a second picture you can see in the middle is one of me. I was running adventure diving out in Jordan. I was very lucky to train who is now the King of Jordan, teach him how to dive. And so I used to work at the Royal Diving Centre out in Jordanian. And another thing that came from all this background work, working with the special branch and everything else, was I ended up being the unit commander of Northampton Police Cadets, which I was very proud of. And again, that was all about looking after wellness and well-being, ensuring people were getting the support they wanted to get. And my proudest moment of that was having 108 kids. I was like a headmaster, 108 children I was looking after, and 18 staff, and looking after their well-being, wellness. And again, my experience allowed me to take them off on the hill, take them up Penny Fan, take them up Brecon Beacons, up to Scotland, and just give them that wellness and well-being support that some people don't get naturally. And the response we got was everybody wanted to come on those courses with us, so it was great fun. Joe, can you go on to the next one, please? So the role the why I wanted to be, a governor was, it's really related to my background and what I do. I wanted to use the network I have to try and support and engage with the community, and trying to get them aware that there's a great support mechanism out there, which is, my beliefs are trying to support people in whatever level of situation they were in personal life. And so I then found myself in 2013, and I'll be honest with you, there was a bit of a trigger here, but in 2013 I found myself stood waiting to take my life on a bridge and on the motorway, and I turned round and went, hang on a minute, this is not really where I want to be, having come from that background, this sort of support background that I'd been in. So that's when I formed Space to Talk with another gentleman who'd been down the same path. So I was life experienced, and we put Space to Talk together, and we used that to deal with people that were struggling and couldn't get through the problems they were getting on. And here we are now, 2025, and I'm a governor within the system, and loving doing the job that I'm doing, and it gives me direct conversations and observations with people that I wouldn't normally contact with, and I can then feed them through the knowledge and the people that I meet that I have done as a governor, and point them in that direction, hopefully that they will never get themselves into a situation that I found myself into. Joe, can you go on to the next one for me, please? And there's just a few things that we do at Space. Obviously, I have to get the old wellbeing.co.uk in, but we take people from all different types of groups. So I work with Ladies of Colour, which one of our other governors is a lead on, and through the university. And we've done so much with so many different people for the last 5 years, just integrating with society and taking them out. And I found that my role has really is changed a lot. But since I've been a governor with the NHFT, it's really brought me home and really underpins what I've been trying to do for my last 20 odd years in my service career. I think the last one, Joe, please. So what are my most satisfying challenges about my role? Well, as I said there, 5,500 delegate employees to get support they need, and which supports for the ever-increasing diverse community. It makes a difference to me, and adding value to the role that I do, and contributing, to the performance outcomes that we've seen. A lot of people have got a lot of negative things to say about the NHS and NHFT, but I actually see it quite positive. And, being part of that quality awards judging scheme last year, it was a real eye-opener for me. I sat there quite humble, realising that these people were just going around being, and I'm very proud to have been invited to be part of that selection process, because these people are just going about their work day to day, really committed to the system and really doing what they want to be, or they need to be doing in the job they do. So it makes me really proud to be a governor, and that's what I find so satisfying but challenging about my role, really. And I'm quite happy to take any questions from anybody over the next 5 minutes. Over to you, Joe.
Thank you, Pete. Thank you ever so much, Pete. That was really insightful to sort of share your journey, and thank you for your candour and sharing your life experience with us as well. It's always a privilege to hear other people's stories. So and kind of get a sense for your passion for well-being and where that came from, and how it connects to what you're doing with us in NHFT now as a governor. So I don't know if anyone would like to ask Pete a question, and see whether there's anything you'd like to explore further with Pete. Doesn't look like yeah. Oh, there's. I think Michael wants to come in. Let me just check
Mhm.
it was. Yes, I think it's Michael first. So over to you, Michael.
Thanks, Pete. That's really, really, I don't mind saying cliche, but very inspiring. And I really, really appreciate your honesty. Thank you. I just wanted to ask Pete, we've talked a lot about the role of governors, and sort of really understanding the governance role that we have, and what that entails. I just wondered, if you were going to be a marketeer for a governor role, what would you say? How would you encourage people to come forward?
Well, I see Richard was just smiling there. We're aware that we can't get people to put their hands up and come and join, and they're not aware of the role that is much needed by people from all diverse communities from all over Northamptonshire. So one of the things I would be, I'm up for banging the drum and making sure people understand and realise, and in a positive way as well, because there is a lot of negativity around, as I said earlier. But we have to look at the positivity. I spent 20, 30 years as a football referee, and not one person ever really shook my hands and said thank you for, that penalty you gave me. So I think we have to reverse the table sometimes.
Thank you very much, Pete.
That's
That's
it.
another skill that you didn't mention, and
No.
much underrated, I think, in some of the skill and the I guess mindset that's needed to do that as well. There's a lot of comments, by the way, Pete, in the
Oh, right.
in the chat, mostly from people saying how inspiring they found what you shared, and thanking you for sharing it, and and that you're a great role model. So there you go. Some really positive comments there. Mark, please.
Yeah, thank you. Well, that was really great, Pete. I really enjoyed listening to you. So a couple of things really. I mean, you very bravely raised the kind of issue about men's mental health, really, and men are traditionally quite appalling about talking about their feelings and whatever. And I just wondered if there's anything perhaps we could have a focus on, or are having a focus on within NHFT around that side of things. And then I think the second thing that struck me as well with your background is just how important it is around supporting service personnel and ex-service personnel. And I wondered if Angela and Krishni could perhaps say a little bit about the Armed Forces Covenant and where it related to that as well.
Thank you,
Yeah,
Mark. It's really, really important. Sorry, Pete, did you want to come back in on the men's mental health
thinking
point?
that, I was really interested in comment there, because there's space, and in the last year we saw 90 people, and there's 90 people, 4 were men and the rest were females, which indicated to me that we have to find these where these guys are. And I've worked with a lot of armed force associations, and they tend to be, it's one of the things that we're putting together at Space at the moment, is to try to find how we can get to these people, because it's not so much the ones that come, it's the ones that don't come that we need to find, and the ones that we need to get through the door, and there is a stigma, and there is a lot of us men will not put our hands up and admit that it's not okay to be okay when we know it is. The ones we find, that's great, and I see and I deal with those, and we look after those. I really struggle across all levels of society to find the ones that don't. And as a suicide prevention person, and I've worked very heavily in that. You never know where they are and what they're doing, so I take that on point. So hopefully the the guys at the top of NHFT might be able to do something, or we can look towards working together to get something, definitely.
Thank you, Pete. I think I'd like to bring Angela in here, if that's all right, Angela. I think there's a proposal, if I remember from your Chief Exec's report, Angela, for a a men's health strategy, which obviously mental health I would expect to feature highly in that. But also there's quite a lot of work going on around veterans access and what our East Midlands Collaborative is doing as well. So are you able to come in on that, Angela?
Yeah, happy to, Krishni. And really, really important that your story, Pete, has already generated this type of conversation. So thank you once again for sharing. But yes, in my Chief Exec's report, I put in that the Health Secretary has announced a new men's health strategy. We're expecting that in 2025. And this is exactly, Mark's touched on it, to tackle the challenges that are described in terms of men not coming forward and perhaps missing opportunities to take advantage of all sorts of services, screening services, suicide prevention, whatever the range will be. But I think that'll be a really interesting piece, and I think we would welcome that here at NHFT. In terms of NHFT, I think a couple of things I would say. So Dave, I don't think David Williams is here with us, but he has really championed International Men's Day, and across our group actually we've done some work together to really encourage people to step forward and to connect, because we know that that's not necessarily so easily done. So more can be shared about what David's done in relation to that, if that's helpful. In terms of the armed forces, again, yes, really important, and one which we do touch on in different points, so whether that's through the covenant, but also, as Krishna's mentioned, we're part of an East Midlands Alliance, which is all the provider organisations for mental health across the East Midlands. And one of the collaboratives that's held within that regional footprint is the Ops Courage, which is around supporting veterans. And that's a really important collaborative piece. So it's one that we get support with, but also we can get support and add to, like we support CAMS in other parts of the services. So there's a lot of activity. There's always more to do. But I think what's important is that the men's health strategy will give us a, if you like, a stronger platform from which to examine what is happening across the system, not just here at NHFT, but really important topic. Thank you, Pete, for getting that underway today.
You're on
Sorry.
mute, Krishni.
I don't normally fall foul of that, but yeah, briefly omitted that. Yes, I realise. I think one of the things I was going to reference was I saw a really interesting example from LPT, actually, our sister organisation, and I think there'll be more of these things that that we can do from a sort of outreach type approach. But it was one that I really liked, because so I noticed it because the team had gone to a truck stop because they recognised that quite a lot of the people who were, lorry drivers, long distance lorry drivers, probably a large proportion were male, and they actually used that as an opportunity for a conversation. So it was a sort of outreach approach, and I think it's those sorts of things that we really need to think about. It's we can't always wait for people to come to us when they need help. We need to think about how we are in places that they might want to, might find it easier to access. Farming communities, for example, so going to fairs and country fairs, that sort of thing, can be incredibly helpful. So in a world where access to services and health inequalities are really important, I think thinking about how we reach people is really helpful, and it needs some innovation, quite clearly. But a really good point that we're having that discussion, as others have said, prompted by Pete's presentation. Duncan, please.
Thank you, Krishni, and thank you, Pete, for a really thought-provoking presentation. and if you'll forgive me, I'll try and make 2 points in one, and in my usual convoluted roundabout manner. Pete, let me just remind you, if you don't know, I'm an accountant by background. I used to work in the health service very recently, and I wanted to start off by saying that we need to value our veterans and our members from the armed services. I certainly did during the pandemic, when I had colleagues from the military coming in and advising and helping us in a large acute hospital. And it struck me just how well trained at all levels of our armed services colleagues are, and how they can bring common sense and leadership to bear. And they have that role in life. But also, your presentation brought out the other side of it, in that many of our veterans come out of their service needing help. And so my question was going to be, how could we engage people from this part of the community into helping us? But others have asked that question, and I think you've dealt with it well. So I've changed the tack, and I thought I'd give a bit more of my answer to it, because I loved, Pete, the way you were describing how men need to get involvement in an activity in many ways, and how you'd use that to bring him into a situation where help can be presented and people can help themselves. And so my point to you was to say, I'm a trustee of a charity which looks after a battlefield which is in our county. And I have got to know in the last couple of years many veterans through the work in that. And indeed, the trustees there have seen actually as one of their 3 core missions over the next 5 years to help veterans far more using the understanding of the battlefield that's in our county. So my reach out is less a question, but more an offer of help. If the Naseby battlefield can do anything to assist you in promoting those activities you described, I'd be more than happy to do that, or anyone else on the call.
Thank you,
Duncan.
Duncan.
Definitely take that up.
Great suggestion. Making connections using networks. That's what we always encourage our governors to do. So great suggestion of making that making that tie up, really, if it's possible. Thank you, Duncan. Melanie.
Hi, Pete. And yes, I mean, I can only echo the comments of all my colleagues in the chat about the breadth and depth of your experience and how inspirational your story is, and the work that you do now. And I was reflecting both over the last few months, late last year, as Wellbeing Guardian, but also as I am part of the Working Carers and Enable network, staff networks, that I think, as has been mentioned, we've debated long and hard how to try and engage our staff, our male staff, in conversations about their health. But also just this week, working carers were talking about the number of men who must be carers for people in their family, children, parents, wives, whoever. And we only have one male member of the Working Carers Network. So I do wonder whether, luckily there's one individual that sort of works across all those networks at the moment, but I do actually think it might be of benefit actually to the chairs of those networks and the people involved, maybe, to get some more insight from you, Pete, about some of the messaging that might be most effective, reaching out to our male members of staff. I mean, we ran a cancer awareness, and I don't think we had anyone turn up to that session. No man turned up. So we know how difficult it is, but it sounds like you've got some great experience and methodologies, maybe, that we could draw on.
Yeah, thank you, Melanie. It's nice to catch up, actually, because I know we were talking before Christmas, and and then moved on in September. But I wanted to go back first just to mention to Duncan, really, to thank him for that offer. But I don't want to tell a little story to the group, really, that after my 23 years of service career, I was sent to Cottesmore for my last posting, and they put me in driver training, and I was doing driver assessment and etc. And on my very last day, I walked up after 23 years, went into the squadron headquarters, handed over my ID card, walked out. Nobody said goodbye. Nobody said thank you for 23 years. Nobody asked me to sign anything. I drove out the camp gate, pulled into the lay-by, and cried my eyes out because I felt so lonely. After 23 years, I had nobody to give me that compassion or support, etc. And that drive that I had from Cottesmore back to Nottingham to where I was living, back to the family at the time, was the loneliest drive I've ever taken in my life. And I never, I would never like any serviceman or any servicewoman to go through that situation. So any time, and I do talks to the Rotary and all the rest of it. Anybody wants, I'm a free agent. I'll just do it because I just want to make sure nobody ever has to sit in that car feeling the way that I felt after 23 years as a senior NCO, leaving the military, and know I had that feeling nobody cares. And since I've been doing and living in Northamptonshire and working with the area and the people that I work with, especially with the people at NHFT, I've actually felt that I've come back into a family. And that's not me, I just really feel welcome and really feel rewarded that I've had to take that space. But now, I'm back where I am.
Thank you, Pete. And sadly, I suspect you're not the only one who's experienced that. And that's why it's so important that we recognise the role we can all play in supporting people who are leaving the service. And that's a formal thing, but also I think there's a sort of recognition scheme, isn't there, Angela, that you touched on it earlier, but in terms of I know our HR colleagues have a sort of there are processes in place to try and make sure that we're looking not just at how we support people from a service user point of view, but also in terms of employment and kind of really good employment practice. So I think there's a kind of gold accreditation and that sort of thing that we've secured, haven't we, Angela, and have maintained. So all these things that I think as NHS organisations have recognised are really important, and we can make a difference as big employers, I think, in welcoming different parts of our community who need that, who need a new home. So really powerful, Pete. Thank you so much for sharing. And I think if we can use your experience, as Melanie says, to kind of help us just think about with our staff networks or others, how we engage more of our male colleagues to speak up and to ask for help and that sort of thing. I mean, we are quite a female, I think quite a lot of NHS organisations have a heavy female workforce, but in all sorts of ways we see less men sometimes involved. I think one of the times that Angela and I noticed was the long service awards, wasn't it, Angela, where we had a whole room full of women who'd put themselves who'd identified that they'd had long service, and very few, if any, men. And sort of said, well, there must be men who've worked a long time in the organisation. So it is all about, I think, thinking about how you reach out and how you make it okay, how you make it accessible, how you make people feel welcome. All those things really matter. So a lot for us to think about and to take forward. So Pete, thanks again, and really appreciate you sharing and continuing to help us with this. I think would be great.
That's fine, and thank you for inviting me, and allowing me to talk a little bit about it, because we don't sometimes get as much limelight, under the torches we should do, and that spotlight's on. Then we should sort of, go out and look for these guys and help support them. So thank you.
Thank you very much, Pete. Thank you. Okay, well, that's I think really helped us get into a sort of insightful discussion. We move on then to our second item in this session, which is Richard's report on various activities that affect or involve the council. So Richard, over to you, please.
Thanks, Christy. Yes, Pete set rather a high bar, I'm afraid, so my presentation is somewhat less inspiring and interesting, but nonetheless. So I'm going to draw out just 3 areas really from this report, given that colleagues have hopefully had a chance to have a look at it before the meeting. The first relates to our governor elections programme, which launches today, and so it sort of echoes the question I think that Michael was posing about how to promote opportunities to stand to be a governor. And the second then relates to some of our work in the Membership Engagement and Representation Committee and seeking Council's agreement to the proposed priorities for the coming year. And then the third relates to some upcoming events for governor and indeed member diaries. So without any further ado, I will move on. So just a bit of governance to start us off, really. So last time at the Council of Governors meeting, we talked about what we wanted to do about some long-standing vacancies on the Council of Governors. Following the meeting, because we had a little bit of technical difficulty with the voting in the meeting, we, as the council, agreed to the proposed way forward, which you can see set out on the slide here. What we also did, because the change required a change in the constitution, was seek council's approval to a minor adjustment to the wording, which was simply to change the numbers in Annex 4 to reflect the new council structure that had been agreed. So this slide really just confirmed that we have indeed agreed that bit with the Council of Governors, and those that were observing the board meeting last week, I think, would also have had the debate that the board had where they also agreed to change. So we have the revised constitution up on our website, which allows us also then to launch our elections campaign. So you'll see set out on the slide here, the elections campaign starts today. We are again working with Civica Election Services to support us to run a compliant elections. You can see that the three positions that we are seeking nominations for are public governors. These are the newly created posts following that change. They're representing Daventry and South Northants locality, Kettering and Corby, and Wellingborough and East Northants. We've got a landing page on the Trust website which contains more information about the role. It has some video content and lots of other information about being a governor. We're also hosting, as we did before, a Becoming a Governor session, which Christian and I, together with some governors, will be hosting on the 17th of February in the early evening. And this is an opportunity for people that are considering whether or not they should stand to come along, have a conversation with us, ask any questions they may have about the role, and also talk to some people that are doing the role at the moment. So if you are out in the community talking to members or members of the public, and do certainly promote the opportunity to stand, assuming that they're eligible to stand in these constituencies, of course, and do point them towards the website, and indeed the opportunity to join us on the 17th of February online for this Becoming a Governor session. We would hope once the nominations period has closed and the elections process, the voting process actually starts, to then be able to confirm the results around the time of the next council meeting in April. So we'd really welcome your support in promoting those opportunities. So the next area, the second area, then relates to the work of the Membership Engagement and Representation Committee, informally known as the MERC. So thanks very much to those governors and to Judith, who attended the last committee meeting a couple of weeks ago. I think we had a really good discussion where we were looking back and looking forward, so celebrating some of the things that we've achieved together over the last year by way of engagement and representation, and also then thinking about what our priorities should be for our membership strategy over the coming year. So you can see again on the slide some good news at the top, that bearing in mind we're only partway through the year at the moment, almost 3/4 of the actions that we'd agreed at the outset have now been completed, and we've got plans in place for the remainder. So hopefully by the end of the year we'll have achieved 100%, which is great news, and thanks very much to governors for their contributions in that respect. Regarding the priorities, then, you can see here three priorities that the membership committee identified for the next year. These essentially build on the priorities that we've had in situ for this year, and with some subtle tweaks. So much in the way that we've been talking through Pete's example about the importance of engaging men. What we reflected in the committee is that actually we need to continue to focus in this area, and had an interesting discussion about actually, whereas in the last year we focused on men of working age, actually there's an opportunity to engage with men of all ages. So we're proposing to broaden out the scope of that particular priority to include men of all all ages. And indeed, much in the same way as the Trust continues its efforts to tackle discrimination, we felt that actually it was right to retain the priority regarding equality, diversity and inclusion. So when we had a discussion about then how we go about implementing those priorities, obviously should the council support them, of course, we felt that actually 1 and 3, which are the priorities that we would be continuing from this year, would be the place to start, because we've got a good plan already in place, and we would then use the time in the start of the year to develop plans for the engagement of men. And we were thinking actually that would then potentially then time in with some of the national events that Angela alluded to that tend to happen in the October-November time of the year. What the committee also then talked about was how we would then ensure that what we're doing reflects what's going on in the wider health and care system. So you may have heard about the government's announcement of the 3 big shifts. So we felt that actually using those 3 big shifts, from analogue to digital, from hospital to community, from crisis to prevention, to actually frame some of our work as well in the local community so that it makes sense with the broader messaging out there in the community regarding the NHS. And then on a really practical note, the committee actually was really asking the council if anybody had connections through their network with local schools, the Chamber of Commerce, parish councils and faith groups, as there were some governors that were very keen to undertake some engagement work in those areas, but didn't necessarily have connections themselves. So if you are somebody with a connection with either of those organisations or places, then please do let us know, as we've got some willing volunteers to connect up with those institutions to do some engagement work. So linked to that, we were pleased to have our most recent webinar for members and for governors on the 29th of January. We were joined by the Strategy and Partnerships team, and we talked about the development of a new group strategy which will replace the current NHFT strategy, often known as DIGBQ, once it's approved at the end of March. So this was a really good opportunity to hear from the Strategy and Partnerships team the outcomes of some of the engagement work, well, quite a lot of the engagement work actually that's been happening over the last few months, and also for governors and members to influence the final product that will be advanced to the board, both at NHFT and at LPT at the end of March. And I'll come on in a moment to talk about the next member webinar, which is coming up in March. So we've included in the pack here some information about upcoming dates for your diary. I won't go through all of these as that would take an awfully long time. But what I did want to point out really is that webinar for members, the next one, which is going to focus on supporting working age carers. Thanks very much to Mark and his team at Northamptonshire Carers, and also to our Working Carers Network for their contributions to this event. Again, I would ask governors themselves to join us at that event and to help us promote the opportunity to members as well. And what I'd also highlight really for governors is that we've got I think the last in our series of workshops with our colleagues at Kettering General Hospital, NHS Foundation Trust Council, happening on Monday evening, and this will focus on the digital agenda, again linking in with that national priority from analogue to digital. So if you haven't already done so, we would be grateful if you could let us know either way if you're coming. I think we are slightly low on numbers from NHFT at this stage, so I really would encourage you to join us on Monday evening. However, if you can't join, as usual, we will make a recording available after the event. So with that, Christian, I'll hand back to you for any questions or comments, and hopefully seek the Council's approval to the member priorities advanced by the MERC. Thank you.
Thank you very much, Richard, and the inclusion of sort of priority of sort of reaching men of all ages does seem very consistent with the conversation that we've had in addition to the other priorities. So that's really helpful to see. I just wanted to highlight, and perhaps you could pick up with Michael separately, that he had asked for some clarification around the wording of the wording of the Constitution, Richard. So if you could perhaps pick that up with Michael outside of the forum today, just so we can make sure Michael's query has been addressed, if that's okay with you, Michael, that we do it that way. And then, yeah, so any questions on the priorities that highlighted? I think they're a good continuation of the work that's been done. And any governors who are involved in Merck who want to comment, that would be very welcome. But if not, I think we'll just note the report and indeed support the priorities that have been outlined. So anybody wants to comment at all? No? Okay, so thank you very much, Richard. We'll support those priorities, and if I could ask you just to pick up the action with Michael on that query, that would be great. Thank you very much. Right, we move on then to, oh, actually, there was something else I was going to mention. Just to say, the elections, it's always a great opportunity, obviously, to get some additional colleagues to join the council, and we always look for a diverse range of experience and skills. So at some point, I think we do usually ask for sort of volunteers, don't we, Richard, to help us with the Becoming a Governor session. So it'd be really great if people are, at least one person anyway, is willing to support that session, or several sessions if we put on more than one, depending on the interest. I think what is always helpful, and what we've learned, and I think we reflected on from the governor, the conversations we had around the changes to the governor constituencies, was it's really important that we highlight the role as very much part of the governance arrangements of the trust, rather than very focused on specific service improvements, because that's a different kind of role that actually there are those opportunities, but it's not very well attuned to the governor role. So I think that's part of what we need to encourage people to think about when they're showing an interest. So we'd be really grateful if governors sort of highlight that to anybody that you're promoting the role to. So thank you very much. We move on then to the assurance section of our agenda, which is first and foremost update really just from myself and Angela, and then from our NED colleagues. Briefly from me, I think you're all aware that we've been, in addition to our recruitment process for Duncan as the new audit chair to replace Saqib, we have been seeking to appoint a group associate NED. I'll be, Carol will be updating the council in the private meeting later, but so far we haven't concluded that process, and I just wanted to make you aware of that because that is referenced in my report. Other than that, I think our formal reports from the last board are available for you to review if you wish, but I would like to take the opportunity to bring Angela in now to just share with us really anything that's high on her agenda at the moment that she feels would be good for you to hear about. So over to you, Angela.
Thanks, Krishni, and good to be here today. So yes, a few things that I wanted to touch on. I know last time I think Dave mentioned the 10-year plan and Richard's alluded to it, but that's clearly really important in the NHS. And again, not going to dwell on that one, but linked to that, of course, is the fact that we've now got our operating planning guidance for 25-26. This is something that we've been waiting for. It's important, and it sets a direction, if you like, for us to adhere to, but also to work as part of a system. So that is really a big focus of our work at the moment. And planning takes a lot of time, a lot of capacity, and a lot of energy from everybody across the organisation and in the system space. And we've got some system discussions next week to try to look at what the money looks like, what the activity looks like, what does the workforce look like, and how can we deliver and respond. I think important to say that there are clearly a range of priorities within that piece and expectations upon us, but importantly, a really significant expectation of everybody living within the financial allocations. And that is, as people will know, challenging, and clearly brings with it a whole set of discussions and considerations, and we as an organisation need to understand that in relation to safety and quality, as well as with our system partners. So that is a really, really big piece of work, and I think that's going to take a series of discussions, mechanisms and opportunities for the board to think about that in this next period before we sign off ultimately. We've got a timeline to do that, and Richard will guide us through that in the board to meet our governance requirements. But I think importantly, there is an expectation for boards to have discussions together across system as well. So again, that's also a change that I would want to highlight. As part of that piece, again, we've touched before on the mental health investment standard. Really important to say that that has been secured through the planning guidance. That is important. It doesn't give us lots of additional money for mental health, but it does give us the expectation in systems that there is going to be mental health spend that increases in line with growth-based growth. And that's important. And it's something we've had in mental health services for some time to deal with the underinvestment that's happened over many years. So I'm really pleased to say that still remains in situ, albeit that it's not a lot of extra money and resources, but important nevertheless. The other bit that's important to highlight is that there is an increasing expectation around productivity. So we've focused a lot in the past around our value and our value programme, and Dave and Paul in particular have spoken about the importance of our value programme, which is our way in which we drive improvements, efficiencies and transformation across our organisation. And that has really stood us in good stead, and we'll continue with that through 25-26. And we also looking across the group in terms of group value. But there's more expectation around productivity now. And I think that's something, again, just to highlight, and probably a future discussion point, perhaps in some time in the future, to understand how do we know we're productive? What do we look at? How could we describe it? And that might be something of interest in due course as well. In addition to that work, we've continued to support partners and to play a full role in the urgent emergency care pathway. We've had a lot of challenge through winter, which is to be expected. It's a very difficult time for people, for pathways and for systems. But I think what we can say, and if Anne was here, I think she would echo that we have sought to problem solve with our partners, and we've sought to support our partners who have experienced, as we've said before, critical incidents that we've needed to respond to. That does challenge our workforce, and I know Itai and Linda are joined us this afternoon. That means we have to understand that clinically as well across our system, not just in our organisation. So that's important. The final two things that I would mention is the importance of our staff survey. We don't have full results for that yet, but I think important to highlight to governors that we've had a very good response rate for our staff survey, just over 60%, which is a high response rate in the NHS. And that means that when we do get the full results, we can really look at the validation of staff voice and understand what's being said. And again, I'm sure that'll be something that we'll come back to. The final bit to mention is the importance being placed, and quite rightly, on the recent independent report into Nottinghamshire healthcare, which has now been published. This is the independent report into the homicides. This is clearly of concern nationally, and of course all mental health trusts are already cited on actions and understanding in relation to that. But now the report is here, there's further expectation for boards to understand the actions that are being taken. And I think that'll be a continual piece through 25-26. But of course, what that brings with it is a lot of media focus and a lot of challenge for staff, I think, who are experiencing, you know, again, a lot of scrutiny, but also a lot of negative stories in the press around services that they are also part of, and that can cause reactions as well. So I think those are the things, Christian, that I would highlight. A lot going on. It's a very, very busy time. I think it's probably in a nutshell, I'd say.
Thank you, Angela. Really, really helpful and comprehensive as ever. Julia, please.
Thank you, Krishni. Could I just add another piece of assurance following on from Angela's highlighting around our financial challenges? So just to say, at our Quality and Safety Committee workshop this morning, we had Paul Sheldon, Director of Finance, and Linda as Chief Nurse, focusing on efficiencies and the potential risk and impact on quality and safety. So just I wanted people to be aware that we are looking at this very seriously, especially at this time of year. And one of the most important things is we had a huge amount of detail and assurance around our quality impact assessments that are undertaken anytime there's a change planned. And so, as you can imagine, through all of this, through all of our programmes, there's a lot of change. And so that framework underpins all the changes that we make and that we plan, and that has patients' perspective, experience, the impact on safety, etc. But just to say, we held the workshop on it and had the opportunity to assure ourselves that that's fully in place, and we'll start to see the results of some of that, I think, as the year goes on. Thanks.
Thank you very much, Julia. Sharon, please.
Yeah, Angela, I just wondered whether it would be possible to share the guidelines that have come from that Nottingham incident with the voluntary sector as well, because we all have our parts to play, don't we, in protecting and avoiding that situation happening. And I just wondered whether there's any lessons learned for us as well. Yeah, we've had a recent example where that could potentially happen, and it's because information wasn't shared, and I'm just interested in any learnings that we can have from that in the voluntary sector as well.
Thank you, Angela. Thank you, Sharon. Angela, did you want to comment? I mean, I guess that can come through MHLDA.
Yes, I think absolutely. I think it's an absolute welcome point, Sharon. I think this is, as you say, a piece for all sectors to reflect upon, and absolutely the right point you make there. So yes, the MHLDA, I think we can take that back in to make sure, how do we get this information out? How do we make sure that it's touching everybody? Because there's not going to be an easy opportunity to do that and to get to every group. So how do we do it? I think it's as important as the fact we want to do it. And I think, Sharon, it's a really important point. So I'll take that back.
Thanks for raising that, Sharon. And this is inevitably going to be have a strong focus over the coming months. And I think I was mentioning to Richard, I had a communication suggesting that there would be a requirement for us to cover this in our public boards, both at integrated care board level and in our own public board. So I think there'll be some initial reflections, but a lot of consideration given to this in terms of learning and of course through our networks as well, because we're all connected to various organisations and have these sort of conversations about what we can learn from other people's experience directly, not just from the reviews that take place nationally. So all those things are important. So thank you for raising that, Sharon. Michael, please.
Thank you, Krishni. Angela, thanks so much for outlining the highlights in terms of the priorities. Just two aspects, please. One is in terms of the sharing the financial sort of risks and burdens across the system. I think that what's really helpful during our conversations now, we're having a lot more sort of exposure, I suppose, as governors in relation to some of the system-wide working. It's not an answer for today, but I'm just wondering if at some future point maybe we could have a discussion for governors to really understand what the implications are for sharing those financial risks and managing the money, I suppose, across the system as well. And secondly, I think in terms of the expectations about productivity, it would just be really helpful again as the organisation sort of fleshes out some of those ways of working, to understand that, because I'm sure I just felt implicitly when you raised that point, you paused a little bit, and I thought, oh, that might be a bit of a challenge for everybody. And I think it would just be really helpful to understand that, because during the workshop we had a really good example of the collaborative, and in a way that's maybe another example of productivity. And I know it's difficult if other colleagues on this meeting weren't at the workshop, but I think it might be another example of how you can improve productivity, but there's always a counter to that as well. So I think in terms of the money and productivity, maybe those are things that you know, as governors, we can understand and also help with some of the messaging out to the communities.
Yes, no.
Angela, before I bring you
Yes,
in, and I will bring you in, just to say, we have got a little opportunity, Michael, in our private meeting. We have got an update for you on finances. I'm hoping Paul is planning to join that meeting. So we will have an opportunity just to talk a little bit more about that. And that is something we thought would be useful to do, because the context for governors is important to understand not just where we are, but what the effect of the system is. So there'll be a little bit of an opportunity today to get a flavour for that, but that won't be the only conversation I think we need to have, Michael.
Oh, sorry, Krishna. But I think also, sorry, for governors, in terms of the dreadful sort of situation with Nottinghamshire, I think as governors we also need to understand, potential implication for our roles as governors and our relationship with the non-execs.
Yes,
yeah, thank you. So back to you, Angela.
Yes, no, absolutely. So, Michael, I think, yes, opportunity around the financial position, as you say, Christian, there may be more today, but we'll keep building on that, because I think it's being built on with NHS England, and we are expecting a new operating framework in this period as well, which will also start to understand how we are, if you like, how we're being performance managed through NHS England, because they will seek to segment organisations and integrated care boards. We have that already through our NOF segmentation, but they are looking and developing that. And of course, system finance is part of that piece. So I think it'd be really important, Michael, to come back to that once we know more about it. The productivity bit, I think the pause well spotted, is because there is a challenge in our sector around productivity. And this is because there is less common data or common clarity on the data across our sectors than exists in acute sector. So productivity in the acute sector is much more understood, measured, managed and reported on. In mental health and community services, less so. That doesn't mean there isn't productivity, but the measures are not as sophisticated because there's not been the same investment in the data side, which we saw through the acute sector by payment by results. So a lot of investment in that data because that was clearly being driven by the payment by results mechanism. I'm involved in national discussions on that because I think it is important to be able to measure our productivity, and we need to be in a space where we can have that equal voice around our productivity. But it's not an easy one. So there's going to be a focus in this next period on length of stay as one of the areas in which we can compare more across mental health providers and community settings, etc. So I've already linked Anne into that work nationally to make sure that we can do that. And of course, Itai, Linda and Anne are also involved in how we're focused on that internally. But yes, I'm championing the fact we need to look at it as a sector, but there's not the same data, and that's the problem. And that means sometimes when they do look at productivity, they're not necessarily also triangulating it with outcomes. And that's a real risk for our sector, a real problem. It's not as straightforward as inputs and outputs. Outcomes are as important and they're less easily measured.
Thank you, Angela. So I think Michael, you're right to raise sort of productivity, finances generally. These are very much sort of things that we're going to be focused on. So it'll be important that governors absolutely understand the sort of context of this. So we'll very much keep these things on the agenda. As I say, we'll certainly start with a brief update later on in the private meeting, but also, keep that on our agenda going forward. And I think you make a really important point about, obviously, we had the session about learning from Nottinghamshire, I think at our last, from the Nottinghamshire experience of supporting that particular case and that situation and the learning from that at our last council meeting. But that is going to be very much on our collective agenda, and there may be some very specific learning around governor's role actually, because the trust involved was a foundation trust as well. So we will definitely come back to that, Michael. I think that's a good suggestion, because I think there are some governance and risk learning from the initial review of the report. If there's nothing else for Angela, I think we will just thank her for the update and note some of those kind of, dare I say, wicked issues, because they are going to be, quite challenging for us all to deal with. But we remain incredibly focused on all of these areas, and amongst all of that, obviously keeping our staff motivated and feeling supported throughout will be really, really critical. And I think governors can play a really helpful role in that as well. So thank you. We move on then to our NED assurance topic, and we thought it might be helpful. I think we touched on this previously to talk about something called a well-led review, which some people will be familiar with the principles of that, and others may not be. So we wanted to share that with you because I think it would be right to say that some governors will have input to the well-led review that started last year. But Judith and Richard are going to lead on this and kind of explain a bit more about it. So over to both of you.
Christy, so I think I'm going to start us off, and Judith and I will then do a bit of a double act with the slides before we invite any questions. So we're just going to cover off three areas. Firstly, what is an external review? Second, what then were the outcomes from our review, and what are we doing as a result of that? So some governors may already be aware that there is a requirement for Foundation Trust to have an externally commissioned well-led review in accordance with the NHS England's national guidance. We're required to do this every 3 to 5 years, and until we did one last year, it had been about 5 years since we had our last review, so it was really timely. Again, in line with national guidance, we're required to commission that review from an external organisation. Hence, we engaged after a procurement process, Deloitte, who worked with us, and also in parallel with our group model partners at Leicestershire Partnership Trust, LPT. That was an advantage to us because it enabled us, given that we're working in a group model, to compare and contrast with an organisation that runs a very similar service portfolio to us and has some shared leadership. So we extracted not only some outcomes just for NHFT, but also some areas that we could then improve on together with LPT. So we received last year the report from Deloitte, which was considered at the board, and Angela and the exec team have then developed an action plan, which again the board had approved. And you can see on the right hand side of the slide here the sort of mixed method that the Deloitte team used. They undertook some desktop research, they attended some of our meetings, they did some one-to-one interviews, and as Christian alluded to, they did some group sessions and surveys in which I know governors contributed. So I move on then. I think Judith can then talk a little bit about some of the outcomes that came out of the review.
Indeed. Thank you, Richard. This is a really busy slide because it actually summarises the findings, the high-level findings from the review, and it was actually really pleasing because the results from somebody coming in and externally reviewing the different aspects of the organisation came up with some really positive findings. The ones that I really wanted to highlight was around the system working, where we as an organisation have been found to be highly collaborative with partners and key in influencing at system level. Our group collaboration that as Angela's already referred to, our staff are positive. Our employer, our response rate to our staff questionnaire was 60%. I mean, that's a really positive outcome in itself. The fact that people want to speak to us as their employers. The leadership, which goes hand in hand with both collaboration and system working. We have a very high-profile CEO in Angela. We have a very accomplished chair in Krishni, and this has provided a really cohesive group of directors, both executives and non-executives. And this is all, if you like, influencing and impacting on culture. Culture being something that the board, if you like, pushes down from within the organisation. It's the values and behaviours that staff are expected to have, and staff are in fact enthusiastic and proud of their workplace. The strategy and vision that the board put into effect was specifically mentioned that there was good engagement levels, not only with the current strategy but also with the future strategy and the work that's been done with staff around that, and patient voice. And this is something that we've discussed with the governor group at different times, but this trust does engage well with patients, and we learn from patients. There, of course, where there were findings where it was felt that there could be some further opportunities to enhance what we currently do. There were suggestions to some amendments to the board's committee structures, that there should be revision to the directorate governance arrangement. So these are all very, very governance related. Then there were suggestions around enhancing engagement from our medical teams about how to extend board development activities. The one that was very close to my heart was around the sharper focus on sustainability, and also how to capture board engagement within the organisation. Very broad suggestions. There were, as I said, no specific findings. That wasn't the purpose of this review. So there was some work done to come up with a work plan, which Richard's going to address. But before I hand back to him, of course, we had some feedback from the governor group, and therefore there was a suggestion that we continue and increase our engagement with our governors. Thank you, Richard.
Thanks very much, Edith. So that then brings us on to then what action are we taking as a result of the review? So I can't capture on a single slide all of the actions that are indeed underway, but it's just a flavour of some of the things that we've completed and are working on at the minute. So, as Edith alluded to, one of the areas that the team from Deloitte highlighted was to strengthen our directorate governance arrangements. I'm pleased to say that actually we've delivered on that now with when Deloitte came in to do their inspection. We were in transition with Anne having stepped into the Chief Operating Officer role. So it was always in plan to recruit to some of the vacant posts, and we took then the opportunity to re-articulate some of our directorate structures underneath that. So that action is complete, and the board were assured by the evidence of that in a recent meeting. In terms of the committee structure, again, as Judith has mentioned on the previous slide, we took the opportunity to fully transition from our integrated assurance committee, which focused on areas of common interest, but had started to pay particular attention to our work in relation to people within the organisation. So that committee has now transitioned fully to become the Trust's or the Board's People Committee. Similarly with the Audit Committee, I think Deloitte observed that we could get greater value if we were to spend some more time focusing on risk alongside our focus on audit. So in addition to changing the name of the committee to Audit and Risk Committee, we have, working with Melanie Sakib and subsequently now that Duncan's here with Duncan, started to then pay a greater attention, as it were, in terms of our time in committee on the risk agenda. So you did mention another key area for us and also for the NHS nationally, which is a focus on sustainability. That stems from the work previously on the NHS Green Plan, and it's worth highlighting actually this is indeed an area that the Care Quality Commission will increasingly be focused on in their new single assessment framework and inspection regime. So building on the fact that we wanted to focus on this area anyway, there's another good reason for us to be looking at this in light of the change in the inspection regime. Enhanced governance arrangements for risk management. For those that have been observing our board meetings over the past couple of years, you'll have seen us make the change from the organisational risk register to a board assurance framework. That is more than just a change in name. That's quite a fundamental shift towards a focus on how we then have evidence of delivery against our strategy. Underpinning that, then, we've done some further work since Deloitte has come in to focus on our corporate risk register, which are the significant operational risks, and really embedding then a culture of risk management within the newly refreshed directorate governance arrangements. And then finally, and this is, again, was a natural evolution of work that we'd already got underway. Deloitte, I think, pointed to some opportunities for us to further strengthen our partnership work with LPT, Leicestershire Partnership NHS Trust, and we have been then building on that through our joint working group, and there'll be indeed some more information to follow as we start to firm up plans that the group board meetings in public from the next financial year. But I think that's perhaps enough of the slides, and we're happy then to take any questions or comments. Before I do that, I may perhaps just check if there's anything that Judith wanted to add in to what I've said there in terms of the action plan.
Yeah, if I may, Richard, because I think I'd just like to address very quickly the assurance that non-executives receive in relation to the well-read review. I mean, first of all, it was a finding, there was a specific comment around NHFT being a learning organisation, and this was very richly reflected in the action plan that was put together. I mean, there were over 20 separate actions that the board decided to act on. So that was, my first observation, big observation, large scale observation. The second larger scale observation was that there were no surprises out of the audit, and I think that needs to be, said out loud, because that shows again the strength of the leadership and also the governance structures in the organisation, that an external party coming in and doing a pretty good extent, kicking of the wheel, it didn't come up with any surprises at all. Now, just to also confirm, if you like, around the assurance. Sorry, I'm getting very distracted because I've just been told I'm about to get cut off, Maya, so I'm going to talk fast. Assurance is received by non-executives around this work stream on several levels. Firstly, not only at committee level, where we discuss the specific strands and specific actions that are relevant to our committee, but also at board level, which is very much a top-down approach, if you like, a top-down discussion of what we're doing, and also at board workshops. So there are several streams where non-execs, as non-execs, we get assurance. So I'm very assured around the work that is being done. So that, very happy to answer questions, but I'm going to have to sign in and sign out quickly. Apologies.
Thank you very much, Judith, and thanks, Richard, as well. And obviously, please feel free to ask any questions. Just whilst you're thinking about questions that you might like to ask, it's worth sort of mentioning that the CQC do a well-led review. This is slightly different, but very similar. It's just that we haven't had a CQC inspection now since 2019, am I right? I think, well, we have actually. No, that's not technically correct. We've had inspections of some of our services. What we haven't had is a well-led review, which is usually triggered by the sort of service inspections. If there are concerns about the well-led aspects, they will do that. So this was a good practice thing to do, as Richard and you have explained, very much encouraged by NHS England, that we do these routinely just to check in and make sure that we're doing all the right kinds of things. I think obviously if the CQC do choose to do a well-led review in the not too distant future, then they would use this as part of their evidence. So it's a helpful step for us to take to support any future well-led inspections. I think the other thing I would say about it, which was helpful, is that clearly if there were lots of things we needed to improve, that would have come out of it. There are lots of things we can improve, but what they were clear about was that was to help us become best in class, actually. And there were already lots of good things we were doing, but were there other things that they've seen other organisations do that we could adopt? So so really positive in that sense. It was almost how do we take ourselves to another step, particularly in the group context. So the good example was digital. We're actually pretty good. We were kind of the feedback about our digital arrangements and opportunities and things that we were doing was actually pretty positive, but could we make better use of that across the group? So it's those sorts of things that came out of it, which were really helpful. And as Angela has said in the chat, we're always learning, and I think Judith reinforced this is about being a good organisation in the NHS, and the CQC would say this as well, is all about demonstrating learning. So it's these actions, the things that we're going to do to take forward and are doing to take forward these actions are demonstrating our desire to continue improving and be better as much as we can be as time goes on. So hopefully that's a helpful additional context, but feel free to ask any questions at all that you'd like to about the review or anything else that came out of it. Everyone content that it was fairly straightforward? Michael?
Yes. Hi again. Thanks so much for the presentation. I think my question probably is going to be a bit predictable. Is really understanding the review and the relationship with the governors, and I think there's a bit of a golden thread here in terms of all of this work and the relationship with governors and the non-execs.
Thank you, Michael. So just to, I'll bring Richard in, if I may, Richard, to comment. Actually, I think the process firstly included, as Richard said, a focus group with governors. So there was definitely the voice of governors was very much a part of it. That preceded a number of you joining. So I think it was, would it have been like February or March last year, Richard? Am I right in remembering that? And obviously, if we do this again, which we will, if the CQC come in or periodically, we would also make sure that the governor voice comes through that. And actually, I think the feedback was pretty positive overall, Richard, if I remember correctly. So do you want to say any more about that?
Yeah, happy to. So you're quite right, Christy. The review itself, as in the fieldwork for the review, took place before a number of people joined the council in April, May time in last year, sorry, 2024. So the feedback reflected the feedback from people that were on the council prior to that point. Some of the things that Governor said, in addition to a number of positive comments, were actually, could we have more face-to-face work? Could we actually get out and see services? Hence, some of the work that we've been doing over the last year to put in place some face-to-face constituency meetings and also to open up opportunities to visit services. And I know several people here have had the opportunity to do that so far. There's only more of that to come. And then as far as the Governor role is concerned, clearly one role, both in the well-led review that we're talking about here and also in any subsequent CQC inspection, would be that the inspectors would want to talk to you about the extent to which the trust is listening to and responding to the voice of the community in making major decisions, and also the extent to which you're ensured, so that you're getting the evidence that the trust is performing well against its statutory requirements. So that would be the whole suite of things, from quality and outcomes for patients, delivering on finance, and also on funding as well. So really, in this case, the predominant role, given the contributions already made by governors, is then to seek assurance from the NEDs that actually we are taking actions on those areas that have been identified, as Christy said, to move from an already very good position to a best-in-class position, and to continue to contribute going forward to the developments. We talked earlier about the group strategy, for example. That would be what I would say at this point, but certainly as we move towards the CQC inspection, we will put in place our routine briefing programme for governors, which will talk through what you can expect and help you to feel confident in contributing to any subsequent inspection. Hopefully that helps, but yeah, more information I think on the governor role in inspections to come.
Thank you, Richard. And I think probably worth saying that really, the Council of Governors is part of our well-led, actually. If you think, you contribute directly to us being a well-led organisation, because actually well-led is about governance and leadership, and the council is a key layer of governance for us in holding us to account. For our engagement with the community and our delivery of performance. So actually, I think seeing us as a sort of collective partnership in the way that we work together to ensure the best possible governance, the best possible leadership for the organisation within the boundaries of our various roles, because we all have sort of given roles, is a really important thing. And that's why I think it's really important that governors sort of are included in the well-led review as they were. But there wasn't a sort of, I think, much more than that, because it was a relatively positive interaction that governors had with Deloitte, I think, and the feedback was quite positive. The only thing I would say, Michael, is probably that although it is now nearly 5 years, as I think in the earlier workshop that we had, it was noted. I mean, we're coming up to 5 years since the original COVID pandemic started, and I'm finding that quite hard to process, that it's 5 years to mark. That feels like an awful long time ago, but I can remember it like yesterday. In terms of being, even the final face-to-face meeting, I can still picture. And then we ended up going online for a long period of time. So I think emerging out of COVID, the sort of service visits issue, for example, took us a long time to get back to a point where we all started doing service visits. So I think there are things that we've hopefully put in place, even since the Deloitte's review, that are strengthened constituency meetings, for example. Those sorts of things I think have all been strengthened, but always open to that ongoing conversation through Merck in particular, I think, is the opportunity, and indeed through constituency meetings and other things. So I see the positive thing about the positive well-led findings very much reflecting the strong councillor governors that we also have in place, but that we can continue to develop together. So really positive overall. Any other questions or comments before we actually come to a close of our public meeting? There are some things in private that we need to cover, which I shall touch on, but if there's nothing else in relation to those items, then there is one other item of business that I particularly wanted to finish on, and that was to mention that Sue Watts, our partner governor for Age UK, this is Sue's last meeting, which is I'm quite sad about, Sue. I feel like you've been on the council pretty much almost the whole time I've been here as a chair. So we've worked together on the council for a very long time. You've been an absolutely fantastic partner governor. I think you've done more than one presentation on the role of partner governors, and there are lots of things I know you contributed to behind the scenes, including helping us with some of more challenging issues we've had to deal with as well. And I know the thing that you will have valued probably most is the fact that you've always been a great advocate for the the older population that I know your organisation serves, but you felt you were a great advocate for. So I really just wanted to thank you on behalf of the Trust and the Council for all the years of service. And picking up from what Duncan said, thank you for your service on this council, and also thank you, for everything you've done through Age UK. Remains an incredibly important partner. So Sue, do you want to say anything?
No, not really. Just it's 7 years I've been on the council. I've loved every minute of it. I've resigned reluctantly, but also I'm very happy about it because I'm now semi-retired. So it gives me more time with grandchildren, more time with my family. I'm still working for Age UK Northamptonshire 2 days a week, so I'm still that passionate about older people and making sure they're looked after. But I've loved every minute of it, even the challenging times, Krishni. When I look back, it was a learning curve, and I just wish everybody all the best at NHFT because it's been great. Thank you.
Oh, thank you very much, Sue. And although, as Sue has explained, she remains in a perhaps in a slightly different capacity or in reduced hours with Age UK, we are getting somebody joining us from Age UK as our new partner governor, who I believe is Chris Duff. And Chris is, I think Richard and Joe have done an induction for Chris. So we will continue to enjoy the advocacy for the population that I know we're all passionately want to support, which is our older age population. So through Chris, we will still have that, but we will miss you, Sue. And I just, as I say, wanted to say thank you so much because you've been a great friend to us in so many ways. So thank you very much. I also then want to bring the council meeting to an end, but just a reminder that we have got a private meeting. So I suggest we're a little bit earlier, but I mean, if colleagues are happy, we can perhaps start our private meeting at 4:35, if that's okay, or would people like a short break? I'm just conscious that if we've not got a huge amount of business, so if we get on with it, we probably let everybody off a little bit earlier might be helpful. So if colleagues are happy, we'd really love you to rejoin on the new link, which is the private council link. I think with your permission, there are a couple of NEDs who are going to join that meeting just to support the updates, a couple of private updates on quality and finance. I think Judith, if you're okay, I think Judith was going to join us as well, and Paul Sheldon also to help us with that. So I will see as many of you as possible there at 4:35. So thank you very much, everybody, for your contribution. Thank you.
Thank you.
Thank you.
Bye. Bye.